Safe helipad and helistop operations involve a multitude of personnel: flight communications specialists, aviators, hospital security, and the medical team on an approaching aircraft must work in unison so that the safety of the patient, the team, the aircraft, and the hospital can be assured. Each person who shares these responsibilities should understand the roles of the other personnel involved. Helistops and helipads are owned and operated by the University of Michigan Health System, UMHS, and are private entities. Prior to their use, landing privileges must be granted to visiting air medical programs and their individual pilots. It's the responsibility of University of Michigan Health System Survival Flight to assist with this verification and training program as much as possible. Upon completion of this training program, visiting Air Medical Transport Program personnel will be able to state rules and regulations required in order to be permitted to land on a privately owned University of Michigan Health System helistop and helipad. Discuss unique operational considerations for landing at the University of Michigan Health System helistops and helipads. State their responsibility of remaining current in training programs and record keeping applicable to University of Michigan Health System helistops and helipads. And identify consequences of failing to abide by the training and notification requirements. Throughout this, we will refer to University of Michigan Health System policies that specifically address operational considerations of our Mott Children and Women's Hospital rooftop helistop, the dual main hospital helipads, and the alternate landing helistop. Copies of these policies are included for review and reference. Once this initial training program is completed, visiting air medical programs and specifically their aviation personnel will be granted landing privileges. It's the responsibility of each program to notify University of Michigan Health System Survival Flight of a pilot's completion of this training. Failure to follow these procedural guidelines will result in a violation of our agreement and the loss of future helistop and helipad use. Prior to conducting any flight into a University of Michigan Health System helistop or helipad, visiting air medical programs are required to first contact Survival Flight Communications at 1-800-822-2233 to access compliance with training requirements, ascertain helistop and helipad weather conditions, and receive notification of potential obstacles such as construction cranes that may be adjacent to our helistops. Visiting air medical programs must contact Survival Flight Communications 10 minutes from landing and 2 minutes prior to departing any University of Michigan Health System helipads and helistops on frequency 130.6. Wind indications taken at Ann Arbor Municipal Airport, KARB, are the controlling values. Visiting air medical programs will not be allowed to land at the Mott Children and Women's Hospital rooftop helistop if winds exceed 20 knots. Additionally, when reported weather is less than an 800-foot ceiling and 3 statute-mile visibility at the Ann Arbor Municipal Airport, the helistops and helipads will be closed to all visiting programs. Whenever these conditions are met, the flights must terminate at the Ann Arbor Municipal Airport. University of Michigan Health System public safety personnel require a minimum of 10 minutes advance notice to complete helistop inspection requirements prior to approving that the helistop is available for landing. It is mandatory that all hospital security personnel be present for all landings and departures. All forms of hot loading and unloading are forbidden on all University of Michigan Health System helistops and helipads by visiting programs. At no time will any single-engine aircraft land atop the Mott Children and Women's Hospital helistop. If a single-engine helicopter requests to land with a trauma patient atop the Mott Children and Women's Hospital helistop, the single-engine aircraft will be directed to land at the auxiliary helipad. From the auxiliary pad, the patient will be transported by ground ambulance to the Mott Children and Women's Hospital. If a delay in ground transportation is expected, then the aircraft will land on one of the two main helipads and the patient will be transported through the hospital to the Mott Children and Women's Hospital. In the event of a fire atop the Mott Children and Women's Hospital, there are two exit points on the roof. The first is the stairway at the east end of the rooftop pad. The second is along the heated walkway to the elevators. Once inside the building, from either location, take the stairway down and call 911 when time permits. Located on the heated walkway across from the main rooftop access doors is the Fire Suppression Activation Station. To activate the foam fire suppression system on the helipad, lift up the plastic cover and pull the handle. The foam should start dispensing from the fire suppression nozzles. All University of Michigan Health System helipads and helistops have a noise abatement area in close proximity to the pad complex. The physical layouts of the buildings pose some turbulence in and around the helistop atop the Mott Children and Women's Hospital helistop. Pilots should exercise caution while approaching. Adherence to wind limitation policy is required. Approaching from the north, follow US 23 to the M14 split north of Ann Arbor. Turn westbound along M14 and follow M14 to the Huron River. Turn southbound and follow the river to the appropriate UMHS helipad or helistop. Remain west and south of the Kellogg Eye Center at all times when following the Huron River. Approaching from the northeast from Domino's Farms, fly between the blue Ann Arbor Water Tower and the radio antenna, avoiding the housing areas to the west of Domino's Farms. Continue straight in for landing at the appropriate UMHS helipad or helistop. Arriving from the south, pilots should follow US 23 to Domino's Farms and then turn southwest towards the university. Fly between the blue Ann Arbor Water Tower and the radio antenna, avoiding the housing areas to the west of Domino's Farms. Continue straight in for landing at the appropriate UMHS helipad or helistop. Approaching from the west, follow I-94 to the M14 split and proceed eastbound along M14 to the Huron River. Then turn right and follow the river to the appropriate UMHS helipad or helistop, remaining west and south of the Kellogg Eye Center at all times. The area along the Huron River just west of US 23 between US 23 and the VA hospital is noise sensitive and should be avoided by adhering to the procedure described above. If the patient is experiencing compromise of life or limb and taking a more direct route is more favorable, please alert our communications center as you arrive so we can document this requirement as you proceed to UMHS. When departing any UMHS helipad or helistop, please follow the approved departure corridors when returning to your home program. Please expedite your climb to 1,000 feet AGL when possible and avoid overflight of downtown Ann Arbor at all times. Safe helistop operations are the responsibility of each member of the teams who use them. Each team member must be knowledgeable in normal operations of helistops, as well as emergency procedures that follow, should an event that warrants their implementation. Air medical programs that visit any of the University of Michigan Health System helistops and helipads are encouraged to conduct initial and recurrent training with their team members. Should you wish to conduct more extensive training, please contact Survival Flight Communications at 1-800-822-2233.